first, live, local. This is Fox 12 Now.
And welcome back to Fox 12 Now. Thanks for joining us. We're live streaming here at the Fox 12 Oregon newsroom. I'm Greg Nibbler. We're here every weekday from 1 p.m. to 4 p.m. covering a wide range of topics. Right now, though, we are talking about the measles. We've seen some cases nationally, and here in Oregon, that is no exception. There is a recent case that was just announced by the Oregon Health Authority in Clackamas County. And so we're going to talk about that and just about the measles in general, what you should know from all aspects of that. To do so, joining us right now, we have Dr. Lauren Walker from Oregon Health Sciences University. And Doctor, thank you very much for being here and for joining us for this. And, you know, I think to start off, would you mind letting us know, I want to get into the actual measles itself, but for people who don't know about this newest case, would you mind just letting us know what we do know about that?
Yeah, absolutely. And thanks for having me, Greg. So we know that there's been one case in the last week in Clackamas County, and that comes after two recent cases down in Lynn County earlier this year, about 10 days ago now. We don't know much about any of the individuals who came down with measles, but we do know that all three of them were unvaccinated.
Okay, so unvaccinated but have contracted it. We don't know much more about the spread on that. And I think to just go to the very basics, for anybody who doesn't know, could you mind just walking us through, you know, what the measles actually is and what it does to someone who does become infected by it?
Sure, absolutely. So measles is a viral infection, and it's the most contagious infection that we know of. And in most people, it causes sort of a cough and cold type illness initially. And then later on, you get a rash that starts on your head and then moves down onto your body, into your trunk. And with that, people usually feel pretty crummy with fevers and not feeling well. Often, measles can be complicated by other problems like pneumonia or ear infections, but occasionally it can affect things like the functioning of the brain, and people can get encephalitis. People can get life-threatening lung disease and have trouble breathing. And then we also know that measles has an effect on the immune system, where after you have measles, you're now more vulnerable to other diseases as well.
And is that lifelong? You'll be more vulnerable?
That gets better with time. It's sort of, we think of it, or we talk about it as immune amnesia. Your immune system sort of forgets some of the things it's already learned. It can learn them again when you encounter those germs in the future, but you lose some of the immunity you already had to things that you've caught in the past.
Interesting. And for you mentioned it being the most infectious that we know of. So as far as that, you know, how is it that people can become infected?
Right. So measles spreads through the air after a person with measles coughs. In general, we think if you have an unimmunized or vulnerable population, if one person gets the measles, they tend to spread it to between 12 and 15 new people. If you are unvaccinated and vulnerable to the measles and you run into a person who has measles, you've got about a 90% chance of catching it. So it's really, really easy to catch. And those virus particles can circulate in the air for a couple of hours. So even somebody who's been in a room and maybe coughed some measles virus, an hour or two after they've left the room, you can still catch it. So it's a very, very transmissible virus, very easy to catch.
Wow, yeah. So what are some ways that people can try to make themselves more resistant to that?
So first and foremost, vaccination. You know, we've had the measles, mumps, and rubella vaccine for over 50 years here in the United States as a combined vaccination. It's safe, it is effective, it gives you lifelong immunity once you've been vaccinated. So first and foremost, making sure that we're all up to date on our vaccines and we get them according to the schedule that keeps us and our kids and our community safe is the biggest thing that we can do. Other things that we do in general for viral infections, like covering our coughs, washing our hands, staying home when we're sick, all of those things will reduce the transmission of measles as well. But we really have a powerful tool in vaccination that can protect us from this infection.
And how old does someone have to be before they can get the measles vaccination, say for newborns?
Yeah, so typically we give the first vaccination at 1 year of age, and then a booster right before kids go to kindergarten at 4 or 5 years of age. In emergencies, babies down to 6 months can get the vaccine. But one other thing that helps protect babies is if the baby's mother has immunity to vaccines, the mother will actually pass some of those antibodies to the baby. So in that first 6 to 12 months of life, babies actually get some protection based on their mother's immune system.
For people out there who may have been exposed to the measles, and what is one of the first things that they should do?
If you've been exposed to the measles and you've been vaccinated or have had measles in the past, then you can watch for symptoms like cough and rash, but you're probably okay. You're unlikely to develop illness. If you're vulnerable to measles, you've never had it in the past and you're not vaccinated, there's actually still time to be vaccinated. So if you're exposed to measles and you get the vaccine within 72 hours of that exposure, that usually prevents any illness from developing. So you actually have a chance there to prevent it before you get sick. If for whatever reason, maybe due to a medical condition, you're unable to be vaccinated, then usually we'll watch for symptoms in the next 21 days. And if you start to have that kind of cough, cold type of illness, that may be the beginning of a measles illness.
How long is that incubation period for measles before you start noticing some of the side effects?
Yeah, it can be as long as 21 days. 10 to 14 is a little more typical, but when we are worried about an exposure, we usually keep an eye out for 3 weeks for symptoms to develop.
Yeah, that's got to be, so if somebody is out there and has contracted it, and so they could have been out there for a couple of weeks walking around, spreading this around.
Yeah, yeah. And one of the tricky things about measles is that it becomes contagious. You can spread it to other people even before you've had any rash. So you might have a cough and a cold, but we get those fairly commonly here in the wintertime. So if you contract measles, you can spread it before you even know you have it.
And you mentioned, vulnerable people who may, I don't know whether, I guess if they do have the vaccine, it sounds like even if you may be more vulnerable to other diseases, that this is something that would still protect you. Is that right?
Yeah, the vaccine really works quite well. There are some people who can't receive the vaccine. So people who are immunocompromised, who have cancer, who have received organ transplants, who have immune systems that are not as strong. Either the vaccine may not be safe for that particular individual, although it's safe for others, or maybe it just won't work because their immune system doesn't develop a strong response to the vaccine itself. And really, those are the people who I think having everybody else vaccinated really protects. Because if we've got a high level of vaccination in the community, then when we do have a case or two like we've had in the last couple of weeks here in Oregon, if lots of folks are vaccinated, then the outbreak tends to sort of fizzle out. We call that herd immunity, but it just means there aren't enough people who can catch it. In other places, like we saw last year in Texas, and unfortunately we're seeing now in South Carolina, in communities where those vaccine rates are low, then you can have a true outbreak where lots and lots of people get sick.
Is there any concern of a potential outbreak in Oregon or even Washington?
It's happened before. So a number of years ago, we did have a sort of smaller outbreak in Clark County in the Vancouver area. And what we find is that sometimes even if the community at large is well vaccinated, sometimes there are specific sub-communities. So for instance, in Texas, there was a Mennonite community that had low vaccine rates that really fueled that outbreak. And so I think, the best thing that we can do now is to, reach out as the healthcare community to people to encourage vaccination. And then I think if people have questions, they should be talking to their trusted healthcare providers, because that's really where they will get the best information about measles and vaccination.
All right. Anything else that you think is important for people to know just about this or the measles in general?
I think that what I would hope folks remember is that the safe and effective measles vaccine can protect you and it can protect your children, but it can protect all the people around you. So people in your community who can't be vaccinated, who can't have that immunity to measles, if we keep those vaccine rates high, we can protect everybody.
So bottom line, get the vaccine, it sounds like.
I think so, yeah.
All right, well, Doctor, thank you very much for joining us. I really appreciate your time and just getting this information out there for everyone to be a little more knowledgeable about what they can do to prevent this and also what to do if some of those exposures happen. So thanks for being here on Fox 12 Now.
Yeah, thanks so much for having me, Greg.
And for everybody watching, again, we are live streaming, as I mentioned. We're going to go ahead and sign off for now. So if you see this on YouTube or Facebook or wherever you're watching off those platforms, you'll see this video end. Good time to download the Fox 12 Oregon app, where you can watch this both live and after the fact and everything else that we do here at Fox 12 Oregon. So lots of things for you to check out on there. Just go to wherever your app store is and you can download that and put it right on there. That's with Fire TV, Roku, and Apple TV as well. But that's it for right now. We'll talk to you soon. I'm Greg Nibbler. This is Fox 12 Now. All right. Thank you so much.
Yeah, thanks so much for having me.
Yeah. All right. Have a good one.
Yeah, you too.